Hello friends, welcome to a new lecture today on cavernous sinuses, that is 8.45 image for image discussion, that is cavernous sinuses. So cavernous sinuses are the paired sinuses which are present on against the lateral aspect of sphenoid bone, that is on either sides of the sella turcica where the pituitary gland exists. So it is present on either sides of the pituitary gland. This cavernous sinus receives blood supply from the cerebral veins, ophthalmic veins and the emissary veins. This cavernous sinus is a pathway for infections to pass from extracranial sites to the intracranial sites. The structures traversing through the cavernous sinus mainly include the internal carotid artery and the abducent nerve. These both internal carotid artery and abducent nerve traverses through the center of cavernous sinus, whereas through the lateral wall of the cavernous sinus from superior to inferior, the nerves which will traverse through the cavernous sinus are oculomotor nerve, that is cranial nerve 3, trochlear nerve, cranial nerve 4, then ophthalmic branch of trigeminal nerve and maxillary branch of trigeminal nerve. The right and left cavernous sinus can also be connected with each other with intercavernous sinuses on the anterior and posterior parts of pituitary stack. So, this is about the cavernous sinus. Thank you guys for watching my lecture. Thank you.